There are new guidelines tonight to keep infants safe while they sleep. The director of the UVA Newborn Nursery, Dr. Kellams, is here to tell us about them. And how common are sleep-related deaths? I mean, things keep changing about the best way for a baby to sleep. Is this a common problem?
Unfortunately, we still see about 3,500 infants every year that die suddenly and unexpectedly during sleep, and many of them are felt to be preventable.
And of course, any is too many, but we want to prevent as many as possible.
Exactly.
What are some of the big changes now as far as how a baby should be sleeping compared to previous guidelines?
So the newer guidelines have an emphasis on newborn skin-to-skin contact with their parents, which is a little different, but shown to really help with vital sign stability. So while the parent is awake and monitoring the baby, being together, there's also more of an emphasis on sharing a room with the babies, not a bed, but a room, sleeping close proximity to their parents for the first 6 months and even up to a year. And another emphasis on breastfeeding as a preventive strategy to help lower the risk of sudden infant death syndrome, and a recognition that moms are exhausted and tired and might fall asleep with baby. And so doing that in a planned space that is as safe as can be in case she does fall asleep.
You want to teach independence, but not from day one. What about a safe sleep environment for infants?
Yes, so always sleeping on the back, on a flat, firm mattress. No other pillows, blankets, comforters, soft bedding, plush, stuffed animals of any kind, just baby on a flat surface on their backs. We worry about the products that prop babies up, like car seats, swings, the things that rock and such. Keeping the baby more upright are not as safe. And then of course a tobacco-free environment, no smoke exposure, and being very careful about medications or substances that the parents might be using that could affect their level of awareness or ability to respond to the baby.
Those kind of universal and perhaps in place for longer and not changing as often as sleep areas.
Exactly.
All right, Dr. Kellams, appreciate your time this evening. Thank you.
Thanks for having me.